Welcome to the audio podcast for radiology imaging cancers. I am Ashok Srinivasan. I'm one of the deputy editors. And today we have with us Dr. Michelle Roytman, and she is a resident from Weill Cornell Medicine in New York City. And we are going to talk to her about her RSNA grant titled Dynamic 68 Gallium Dotatate PET and DCE Perfusion MRI in Meningioma, correlation with molecular pathology and clinical outcomes. Welcome, Dr. Roytman.
Thank you so much for having me.
So at the start, would you like to talk to us a little bit about your motivation for choosing this particular project? As most people are aware, many of the brain tumor projects tend to focus on gliomas and do not really deal with meningioma, which is considered more of a benign neoplasm.
Definitely. So my research mentor, Dr. Yana Ivanidze, is dual fellowship trained in neuroradiology and nuclear medicine. So she's always looking for ways to combine these two interests. When our institution started offering dotatate PET, she was very eager to use it, particularly for intracranial tumors. The pituitary gland is the only intracranial structure with physiologic dotatate uptake, while the remainder of the brain is non-avid, which makes intracranial pathology an interesting way to apply its use. There's actually quite a number of CNS tumors that express somatostatin receptors on their cell surface. For example, paragangliomas, esthesioneuroblastomas, and meningiomas, to name a few. Given how prevalent meningiomas are, it was a great place to start, particularly for the specific clinical question of distinguishing residual or recurrent disease from postoperative change, since both could present as dural thickening and enhancement. The neurosurgeons and radiation oncologists at our institution were really excited about this potential role, and use of dotatate was increasingly discussed during multidisciplinary tumor boards. With a strong interest, we thought it was important to study its use for this indication, which is how the project began.
I found dynamic PET tracer kinetics in your project a very interesting topic because we don't really talk about PET tracer kinetics a lot. We focus on MRI for that aspect. So what do you see the role of dynamic PET tracer kinetics in meningioma evaluation, and do you think this can be applied in other tumors elsewhere?
Yes, definitely. Just as you said, unlike conventional PET, which is a snapshot static time point, with dynamic PET, we're gathering data on tracer uptake throughout the entire duration of the exam and can then generate kinetic curves for different volumes of interest. This gives us a better sense of pathophysiology of the various structures. The pituitary gland has a completely different kinetic curve than does meningioma, than does post-treatment change. In theory, perhaps there's something unique about these kinetic curves of meningiomas of different Hu grades, or perhaps meningiomas that are more likely to recur have a specific type of kinetic curve. We're hoping to analyze these kinetic curves to identify if there may be specific curves relating to the biologic nature and propensity for recurrence or invasion of these meningiomas. The physicist who we work with, Dr. Nicholas Karakatsanis, is an expert on whole body dynamic PET, and he's already applied this concept to other tumors. He has a recent paper investigating whole body dynamic PET for oncologic imaging, specifically looking at lung or abdominal lesions, and found that whole body dynamic PET achieves superior lesion detectability with reduced false positive rates when compared to standard of care static SUV. It seems like there's a lot of potential with dynamic PET, but we still need to investigate its use in the application of meningioma management.
Great. Thanks again. Could you update us on your results so far? And could you also tell us about any challenges you faced trying to implement your project?
Yeah. So we're still in preliminary data analysis stage, but looking at a subset of our patients, we have looked at some of the dynamic PET data. There's a value termed Ki, which we can extrapolate from the dynamic data. It's sort of analogous to SUV reported for static PET. Each volume of interest can have its own Ki value, which could have clinical implications. So, for example, the pituitary gland can have its own Ki value reflecting kinetics of it, as well as meningiomas and post-treatment change. So within a subset, we correlated the dynamic Ki values with static SUV. We found there's a strong, significant positive correlation between dynamic Ki and static SUV in the meningioma and post-treatment change cohorts, suggesting early and sustained binding of dotatate to the somatostatin receptors on meningiomas. On the other hand, we did not identify a correlation between dynamic Ki and static SUV in normal appearing pituitary glands, suggesting a rapid washout from the pituitary gland, which is concordant with findings from the NETTER-1 Lutathera trial. And this may explain why, despite avid dotatate uptake of the pituitary gland, clinically significant pituitary toxicity has not been reported with Lutathera, which is the therapeutic analog of dotatate.
That's very interesting. I'm going to digress for a second here and ask you another question about meningioma, which may not be directly related to your project. So often surgeons want to know before operation whether a meningioma is really hard or is it soft, because they can plan accordingly. Do you think any of the metrics that you are looking at in your study can help in this particular assessment?
Yeah, so that's the goal, to use these advanced imaging techniques to help guide surgeons and radiation oncologists to provide some additional insight about the biologic nature of their patient's specific meningioma. So the way that we're evaluating this sort of consistency is by investigating somatostatin receptor 2 density and vascularity and how these are related to each other, as well as clinical outcomes. We're hoping this data will tie together to provide some additional insight for the surgeons.
And in the overall scheme of things, how do you think RSNA has helped you achieve your goals? And do you plan to pursue this further with any external funding?
So this has been a really exciting opportunity for me. I'm still, figuring out where I see myself in the future, but I have learned a ton through this. I've gained a lot of skills. For example, just realizing the impact of the multidisciplinary approach. We have neurosurgeons and oncologists and pathologists and physicists who are working with realizing the importance of collaboration and problem solving, communication, and time management. I don't know exactly what I'll be doing in the future and, what sort of funding I will be pursuing, but this is
going to be a neuroradiology fellow?
I am. Yeah.
All right. Way to do it.
Yes, I'm staying at Cornell and I'll be doing my fellowship here. But
awesome.
This was a wonderful opportunity, and I really would encourage all residents and fellows to consider doing so.
Yeah, we hope to see your name in other future grant applications, be it to RSNA, ASNR, or other external funded mechanisms as well.
Absolutely.
So thank you very much for your time, and thanks for sharing your data as well as some of your preliminary results with us, so our readers are better aware of how we are doing in meningioma evaluation. Are there any last-minute parting thoughts?
Another really exciting aspect of this project is some of our radiation oncologists have been investigating using dotatate PET for radiation treatment planning. And with some of the preliminary data they've looked at, they've seen that it can really improve targeting by significantly reducing planned target volumes, as well as mean and max doses to organs at risk. So that's another really exciting, different perspective that the dotatate PET has been able to offer to these patients.
Well, thank you. Well, I've been in neuroradiology almost 17 years, and every day I learned something new, and today was no different. Thanks again, Dr. Roytman, for joining us today.
Thank you for having me.
Hello, my name is Dr. Bonnie Jo. I'm the Chief of Breast Imaging at the University of California, San Francisco. I'm also one of the deputy editors for Radiology Imaging Cancer. And we're here today to talk with Dr. Sarah Eskreis-Winkler, who's a breast imaging fellow at Memorial Sloan Kettering Cancer Center. And she's also a recipient of one of our RSNA Research and Education Foundation grants. And we're going to talk about her project entitled Multi-Site Deep Learning Initiative with Decision Support to Improve Diagnostic Accuracy of Breast MRI and Reduce Unnecessary Biopsies. So welcome, Dr. Eskreis-Winkler.
Thank you so much.
Thank you for speaking with us today. Just to start us off, can you share with us some background about this research project? What are you trying to achieve, or what's the goal?
Sure. The goal of my project is to use deep learning to improve how well breast MRI detects cancer. Breast MRI is a very powerful tool for breast cancer detection. It picks up almost all breast cancers at a very early stage. The problem is that it also flags too many false positives. And this leads us radiologists to recommend breast biopsies, which in retrospect were unnecessary. In my project, I'm designing a deep learning system to try to improve the diagnostic accuracy of breast MRI. In the first part of the project, we are simply training the deep learning system to distinguish between cancer and not cancer. In the second step of the project, the part I'm most excited about, we are trying to figure out how best to synergize the efforts of the radiologist and deep learning. We know that humans make mistakes, and we know that computers make mistakes. The really interesting thing, though, is that they don't make the same kinds of mistakes. And so in part 2 of the project, we're working to train the deep learning system to identify the breast MR cases in which the radiologist is likely to make an error, and to identify the cases in which the computer is likely to make an error. The goal is to try and find the subset of cases where there is a high probability that the radiologist is wrong and the computer is right. This would be extremely useful, because then even if our deep learning system doesn't outperform radiologists across the board, across all MRI cases, if the radiologist was encouraged to defer to the deep learning system on that subset of cases that have a high probability of human error and a low probability of computer error, this would allow us to push the diagnostic accuracy of breast MR above and beyond that which a radiologist or a computer could achieve alone. This kind of thing could be applied to improve the diagnostic accuracy of breast MR, as we're trying to do in this project, but really it could also be applied much more broadly as well.
That sounds wonderful. Now, for those of us who may not be familiar with deep learning, can you explain a little bit more about that? Is this the same as artificial intelligence?
So artificial intelligence, or AI, is an umbrella term that refers to the development of computer systems to perform tasks that traditionally have required human intelligence. Machine learning is a subcategory of AI that refers to computer systems that are able to learn and improve without being explicitly programmed. And then deep learning is a new powerful type of machine learning where neural networks, which are inspired by human brain architecture, can learn from very large amounts of data. These neural networks have multiple hidden layers of neurons, which is why they're called deep. The exciting thing is that in well-defined repetitive tasks, deep learning has been shown to meet and in some cases exceed human-level performance. And this makes it a really exciting area with lots of potential applications. And one of those areas is in medical imaging diagnostic.
Now, today I was just talking with a potential future radiologist, and she asked me if these artificial intelligence algorithms are going to replace what I do. What would you say to that?
Sure. So I think it's a really exciting time to be in radiology. I think one of the things that initially drew me to the field of radiology was the fact that it's a field that seems to redefine itself every couple of decades, first with X-ray and fluoroscopy, and then CT, and then MRI completely changed everything. And now we're in this midst of a new revolution. And I think that there was initially a lot of concern among radiologists of how this is going to change our workflow and to what extent some of the tasks that radiologists traditionally do may be replaced by machines. The way I think of it is that there's 2 areas that these AI tools may be used. In one, I think that they're going to replace these mundane, repetitive tasks, which are not the reason why any of us went into radiology. And I think that's something that we should welcome and try and integrate into our workflow. The second area that I think that deep learning and AI is going to transform how we do things is computers have the ability to extract higher order information from medical images that are not visible to the human eye. And so trying to incorporate that into how we humans interpret images in a synergistic way, and I think I'm trying to do that a little bit in the project of trying to synergize human and machine, really has exciting potential to not replace us. I think that's a simplification, but to try and work together to really push the envelope of what we can do in terms of prognostication, of which treatments are going to work, or just, I think it opens up a field of possibilities of what radiology will be able to do with human and machine together. And so that's why I'm so excited about being in this field now.
Me too. I can't wait to get rid of some of the mundane tasks that we have to do. So I'm all for that. Now, certainly this project sounds very sophisticated, and you would probably need some special computing power. Or give us a little sense of what's involved to do this line of research.
Sure. So I'm very fortunate to be doing it at Memorial Sloan Kettering, where they've been very supportive of this kind of work. I think that Memorial is a hospital that's traditionally done a lot of radiology research, but this is a new area, and so it brings with it new challenges. As you mentioned, it's important to have a lot of computing power. That's what initially allowed the field of deep learning to take off. It's this increase in computing power, and they have It's called a high performance computing cluster that I have membership in and am able to use the general resource of the hospital for that purpose. Other than that, all you need is the computer and the medical images. And again, being at a cancer hospital, we have an abundance of that. Some of the challenges, though, are curating the images in a way that's usable to try and craft well-defined projects that are going to yield meaningful results. But I think that one of the advantages of deep learning and really machine learning and computer science in general is the fact that you don't need this huge infrastructure of a wet lab. And it's sort of a light footprint, both in terms of the personnel that need to be on the project. Like I'm able to do basically the project itself. It's a self-contained project for me, but also there's flexibility in it that everything's remote. And especially these days, it's very helpful to be able to do that. So not having to be in a certain building, but being able to just have a laptop that can connect anywhere in the world to these data warehouses and then the computational power.
Yes, no, that I was going to ask about the remote work, because certainly we're recording this during a time of COVID-19 and we're both sheltering in place. So I was wondering if that has slowed down your research or if you've been able to continue.
Yeah, so it's enabled me to continue on, although there are unanticipated challenges because of that. The hospital does have VPN access that I'm able to connect onto, but it's not something that I've had much experience doing initially. And so it's much easier to be on site in terms of these deep learning algorithms that we run have to be run over hours and days and weeks. And my laptop is being used for multiple different purposes. And so it's different glitches that occur that wouldn't happen were I on site.
So tell me, how did you get interested in this line of research?
Sure. So my PhD work was in MRI physics and in MRI technology development. In the lab I was in, we were working to develop new MRI techniques and also to improve on existing techniques in an effort to better diagnose and monitor disease. During my PhD, deep learning was just starting to be applied to medical imaging, and it appeared very promising. And I was working on some problems related to MRI image reconstruction, how to take raw MR data, case-based data, and turn it into medical images. And so I spent some time learning how to apply deep learning to that problem. These same deep learning techniques, though, can be applied not only to image reconstruction, but to image interpretation. And so I became particularly interested in applying deep learning to image interpretation or to disease diagnosis for two reasons. First, as I had mentioned before, it's a really fascinating idea that there are these complex patterns hidden in medical images that are not apparent to the clinical eye, but that contain clinically relevant information that can be extracted by a computer and harnessed to improve patient care. And then the second thing is that while I really enjoy doing science for science sake, as a clinician, I'm also very driven to work on problems that are going to have a real clinical impact. And not only is deep learning fascinating, but it's really going to have a real clinical impact. I think that this AI revolution of radiology is going to be really exciting. And to be part of that process to help define how things are going to unfold is a real motivating factor for me to work on projects like this.
That's wonderful. Very inspiring. And what prompted you to apply for the RSNA Foundation grant program?
So I love being a physician and I find it immensely meaningful to take care of patients. But I'm also really passionate about working on longer term efforts to push the frontier of what we can do today in the clinic so that clinical care tomorrow will even better serve our patients. And so when I heard that this grant would allow me to continue to pursue research during my clinical fellowship year, I was very interested. It was actually Elizabeth Morris, who's the chief of breast imaging at Memorial Sloan Kettering, and who's the scientific mentor on this project, who had suggested and encouraged me to apply. And I'm very, very glad that I did.
And so on that note, what's next for you? Because you're finishing up your fellowship year soon.
Sure. So this year I'm a fellow at Memorial Sloan Kettering, and next year I'll be staying on as faculty there, where I hope that in addition to working in the breast imaging clinic, that over the years, I'll be building up a lab dedicated to AI and breast imaging. I'm interested in the development, but also in the clinical application of AI tools and trying to improve the way that we acquire and reconstruct and interpret breast images, and just excited for that opportunity going forward.
That's great. And any advice for budding young radiologist scientists out there?
Yeah, I think it's just really important to find things that you're interested in and passionate about, because a lot of this is hard work and effort that goes into things. Behind every elegant experiment is lots of time doing mundane preparatory work, like in deep learning, more of the data preparation part of it. And so trying to identify projects that you're really interested in is the key to being successful. Ultimately, I think that trying to chart a path as a clinician scientist is challenging because it's two different careers sort of rolled into one. And so finding that balance is tough, but I think you just sort of have to follow what you're interested in and things fall into place.
Yeah, that's always a good message. Follow your passion. So thank you so much for speaking with us. And we really are impressed with all the work you've done. Looking forward to seeing your career unfold. So once again, this was Dr. Sarah Eskreis-Winkler, current fellow at Memorial Sloan Kettering and new attending in the new year at Memorial Sloan Kettering Cancer Center. Thank you so much for joining us.
Thank you.
We hope you enjoyed this podcast featuring RSNA grant recipients. Please rate, review, and subscribe to this podcast to stay up to date with new content from our RSNA podcasts. Thank you for listening.